There are 6 early warning symptoms of dementia that are often missed or misunderstood, and yet catching them early can dramatically change the course of someone's life. Dementia is not just a natural part of aging. It is a neurological condition that progressively impairs memory, cognition, motor function, and emotional regulation. More than 55 million people across the globe are living with dementia, with Alzheimer's disease being the most prevalent form. While many associate dementia with older adults, the condition actually begins to take root years, even decades, before visible symptoms begin to show. That's why it's crucial to identify the earliest signs, because recognizing them early can open the door to interventions that slow the progression, protect brain function, and give individuals and their families more time, more clarity, and more quality of life. One of the most subtle yet telling early indicators of dementia is a change in posture and movement. These physical signs are easy to dismiss, especially because many people believe stiff joints or slower walking are simply a normal part of aging. However, changes in gait and posture, such as taking shorter steps, shuffling the feet, or struggling to balance, may actually be signals from the brain. When cognitive functions begin to decline, motor control is often affected. People might find themselves leaning to one side without realizing it, walking differently, or even fumbling with utensils or dropping objects more frequently. These movement changes reflect disruptions in the brain's ability to coordinate and communicate with the body. Even subtle balance problems can lead to frequent tripping, falling, or misjudging distances. As coordination deteriorates, day-to-day actions like reaching for a glass, tying shoes, or walking across a room can become unexpectedly difficult. Along with changes in movement, sensory perception is often quietly affected in the early stages of dementia. This includes not just vision or hearing, but how the brain interprets signals from the senses. Individuals may have difficulty perceiving depth, which makes activities like pouring a drink or stepping off a curb unexpectedly hazardous. Someone might find themselves misjudging the height of a step or the location of a doorway. Even small issues like being unable to follow a conversation in a noisy restaurant or feeling overwhelmed by background sound can be clues. In some cases, there is increased sensitivity to sound, where normal environments suddenly feel too loud or chaotic. Hearing loss itself is a major red flag, not only as a symptom, but as a contributor to cognitive decline. When the ears stop working properly, the brain works overtime to compensate, which can lead to mental fatigue, memory problems, and even structural changes in the brain over time. Another often overlooked warning sign involves changes in grip strength and muscle coordination. Many people experience weakness in their hands or legs as they age, but when that weakness becomes pronounced or affects everyday tasks like carrying groceries, holding a cup, or opening jars, it may be more than just getting older. Studies have shown that diminished grip strength is strongly correlated with a higher risk of developing dementia later in life. This connection between muscle health and brain health is often underestimated. When the muscles become weak, individuals are less likely to engage in physical activity, which in turn accelerates the loss of cognitive function. This is a dangerous feedback loop, because staying physically active, particularly with strength training, can help preserve both physical ability and mental sharpness. Maintaining muscle health is not just about staying mobile, it's a way of protecting the brain itself. Sleep disorders also frequently show up as early indicators of dementia, often years before cognitive symptoms become evident. Difficulty falling asleep, staying asleep, or waking up feeling unrested may all point to underlying neurological changes. People with emerging dementia might also develop new patterns of daytime sleepiness, including frequent naps or an inability to stay awake during activities they once enjoyed. In more advanced cases, sleep becomes disorganized entirely. There may be vivid nightmares, physical movements during sleep such as kicking or talking, or repeated awakenings throughout the night. One condition in particular, known as REM sleep behavior disorder, has been directly linked to Lewy body dementia and other neurodegenerative conditions. These sleep disturbances not only affect quality of life, but can also accelerate brain deterioration, as the brain relies on deep, restorative sleep to clear out toxins and repair neural pathways. Perhaps one of the most heartbreaking and subtle early symptoms of dementia is apathy and withdrawal from social life. People who were once lively, talkative, or deeply engaged in hobbies and friendships may begin to lose interest in everything. They might stop going out, cancel plans more frequently, or sit quietly during family events when they were once the life of the party. This loss of interest is not the same as sadness or depression, although they can appear similar. The key difference is that apathy in dementia is not typically triggered by life events. It's a persistent, emotionless detachment from the world that used to bring joy or meaning. Conversations may become shallow, emotional reactions more muted, and initiatives like starting new tasks or even getting dressed in the morning can begin to feel too overwhelming. These changes often go unnoticed until someone close starts to realize they're losing parts of the person they used to know. And then there's the challenge of language. One of the most classic signs of dementia, but also one of the easiest to misattribute to just getting older. At first, it might start with forgetting a word or two, or struggling to find the name of a familiar object. Someone might say thing instead of remote, or call a fork a knife. Over time, the pauses in conversation grow longer. The right words feel like they're on the tip of the tongue, but just out of reach. Entire conversations become difficult to follow. A person may begin repeating themselves unknowingly, using the same phrase multiple times without realizing it. They may lose track of their thoughts mid-sentence. In more advanced stages, even names of loved ones can fade, leaving the person confused, frustrated, and emotionally disconnected. These language difficulties, known as aphasia, often begin long before a formal diagnosis is made and can quietly erode confidence, communication, and connection with others. What makes these symptoms particularly dangerous is that they are often brushed off. A change in walking, probably arthritis. Trouble sleeping, maybe just stress. Missing a few words here and there. That happens to everyone, right? These explanations might make us feel better in the moment, but they can delay the critical early interventions that truly make a difference. If these changes appear consistently, especially more than one at a time, they warrant medical attention. The sooner the underlying cause is identified, the more options there are to slow its progression. Doctors can evaluate for vitamin deficiencies, thyroid imbalances, medication side effects, and other reversible causes before confirming a dementia diagnosis. And if dementia is confirmed, early diagnosis means more time to plan, to support, to connect, and to take advantage of therapies and lifestyle changes that support cognitive function. It's important to understand that while dementia currently has no cure, there are proven ways to delay its progression and improve quality of life. Simple habits like physical exercise, healthy diet, mental stimulation, and maintaining a good sleep routine can help preserve brain health. Learning new skills, solving puzzles, or playing memory games helps build cognitive reserve, which acts as a buffer against brain deterioration. Social engagement, physical activity, and proper nutrition, especially diets rich in antioxidants and healthy fats, can all support long-term mental sharpness. Managing chronic conditions like diabetes, hypertension, and high cholesterol also reduces the burden on the brain. Even something as simple as staying hydrated and sleeping well can have a profound impact on your ability to maintain memory and focus. Early recognition isn't just helpful, it's essential. It gives individuals the opportunity to make meaningful changes while they still can. Memory loss is often the first and most recognized sign of dementia, but it goes far beyond forgetting a birthday or misplacing your glasses. True dementia-related memory loss interferes with daily life in a way that's hard to ignore once it becomes consistent. For example, someone may forget important appointments repeatedly, misplace valuable objects, or ask the same question over and over without realizing they've already received an answer. They might lose the thread of a conversation or recount stories from years ago while completely forgetting what happened just hours earlier. In the beginning, long-term memories from childhood or early adulthood may remain intact, which can make it even harder to notice something is wrong. But over time, even those core memories begin to fade. Eventually, people may no longer recognize their closest family members or remember key milestones in their own life. These types of memory failures aren't random. They signal deeper issues in how the brain processes and stores information. As communication abilities deteriorate, it becomes increasingly difficult for people with dementia to engage in normal conversations. What starts as occasional word-finding difficulty gradually develops into an ongoing struggle to express thoughts clearly. They may pause mid-sentence, forget common words, or use incorrect ones without realizing it. In some cases, they substitute vague terms like thing or that instead of naming what they mean. Over time, conversations become frustrating for both the speaker and the listener. In louder environments like family gatherings or crowded restaurants, following discussions can feel almost impossible. That confusion often leads to withdrawal from social situations where embarrassment or frustration replaces connection and comfort. Sadly, the person may become quiet, hesitant, or anxious in conversations they once would have led with ease. It's not just memory that's impacted. It's the ability to connect, respond, and be understood. Changes in personality or mood are another deeply impactful but often misunderstood aspect of dementia. Someone who was once warm, outgoing, or curious may become withdrawn, anxious, or even suspicious. This emotional shift can be confusing for loved ones, especially when it seems to come out of nowhere. They might notice that the person becomes irritated more easily or starts to express frustration or fear about things they used to handle calmly. It's not uncommon for someone to express sudden distrust toward caregivers or family members, or to misinterpret simple situations as threatening or hostile. These reactions aren't intentional. They're a reflection of the brain struggling to interpret the world around it. Over time, even close family members can feel like strangers, as personality traits seem to fade or shift entirely. The person affected may not realize these changes themselves, which can further complicate relationships. It's heartbreaking, but recognizing these mood and personality changes as symptoms rather than character flaws is essential for compassionate care. Another warning sign is a decline in problem-solving abilities and judgment. Everyday tasks that once seemed simple can suddenly become overwhelming or confusing. For example, following a basic recipe, organizing a shopping list, or managing household bills may begin to feel daunting or impossible. A person might leave the stove on or forget to lock the door. They may make unusual decisions, such as wearing a winter coat on a hot day or giving away large amounts of money to strangers or phone scammers. These types of risky choices are signs that the brain is losing its ability to assess consequences or think through cause and effect. Even tasks as simple as using a microwave or changing TV channels might seem unfamiliar. Over time, decision-making becomes slower and less reliable, and the individual may require more and more assistance to navigate daily life. Loss of logical thinking can increase their vulnerability, not just to accidents, but to being taken advantage of. Disorientation with time and place is another core symptom that often emerges in the early to mid stages of dementia. Someone might forget what day or even what year it is, or they may get confused about where they are or why they're there. A person might wake up and believe they're in a different decade, or think they're still working a job they retired from years ago. These experiences are not only disorienting, they can also be frightening. In some cases, people with dementia may wander away from home, become lost in familiar surroundings, or forget how to return from a simple errand. This is especially concerning when the person is alone or in unfamiliar environments, increasing the risk of accidents or getting lost. Loved ones might notice them becoming agitated when they can't find their way, or forget what they were doing. They might even begin to relive moments from the past, speaking as though events from years ago are happening right now. This breakdown in time perception creates confusion that affects every part of their day. One of the more distressing behaviors for caregivers and family members is repetitive questioning. This happens when the person with dementia asks the same question again and again, sometimes minutes apart, without remembering that they already asked. It can be questions like, "What time is dinner?" or "When are we going home?" even when they're already at home. This repetitive questioning isn't intentional or manipulative. It's the result of the brain being unable to retain new information. Each time they ask, they genuinely don't recall having asked before. This can be frustrating for caregivers, especially when they're trying to be patient, but it's important to understand that the repetition is a symptom of memory loss, not stubbornness. Visual reminders, written notes, or clear routines can help provide structure and reduce anxiety, but the root cause lies in the brain's fading ability to store short-term memories. Another sign that often goes unnoticed until it becomes more serious is misplacing objects in unusual places. This isn't just forgetting where you left your keys. It's finding your phone in the freezer or your glasses in a shoe. People with dementia may place objects in strange locations and then accuse others of stealing or hiding them when they can't be found. These misplaced items are not just absent-minded errors. They're the result of the brain's declining ability to form logical connections and track information. As this symptom progresses, frustration and suspicion can grow, and trust between the person and their caregivers may begin to break down. The person may also lose the ability to retrace their steps, or even remember what the object was used for. These moments can cause confusion, anger, or panic, especially when something important like medication or a wallet goes missing. Hallucinations can also be part of dementia's progression, especially in types like Lewy body dementia or late-stage Alzheimer's. These hallucinations might be visual, seeing people or animals that aren't there, or auditory, like hearing voices or sounds that no one else hears. Some people report smelling things that aren't present, like smoke or perfume. While some hallucinations may seem harmless or even comforting, others can be frightening or disturbing. A person might believe they see strangers in their home, feel watched, or think their possessions are being moved or stolen. These experiences are real to the individual, and dismissing them outright can make them feel scared or isolated. It's essential to consult a medical professional if hallucinations become frequent or intense, as they may be related to medication, infections, or other treatable conditions. Nonetheless, hallucinations often signal that dementia is reaching a more advanced stage and should not be ignored. Incontinence, the loss of bladder or bowel control, is a symptom that typically appears later in dementia, but its impact is profound. A person may not recognize the sensation of needing to use the bathroom, or they may forget where the bathroom is. This can lead to accidents, embarrassment, and eventually a reluctance to leave the house or engage in social activities. Caregivers may find that this is one of the most challenging parts of managing daily care, especially as hygiene becomes more difficult. Incontinence often marks a turning point when families begin to consider full-time support or assisted living, not because of the symptom alone, but because of the level of care it requires. It's essential to handle this stage with sensitivity and compassion. Routines, protective clothing, and clear bathroom signs can help manage the issue, but understanding that this too is a medical symptom, not a personal failure, is key to preserving dignity. As these 10 symptoms reveal, dementia is not a single issue. It's a complex combination of memory loss, confusion, emotional change, sensory disruption, and physical decline. Each symptom represents a different part of the brain that is no longer functioning as it should. And while the progression varies from person to person, the earlier these signs are recognized, the more opportunity there is to act. This might mean scheduling medical evaluations, adjusting routines, or putting support systems in place for safety and peace of mind. But more than anything, it's about preserving what matters most: independence, communication, relationships, and the essence of who someone is. By paying attention to these warning signs early, families can better prepare for what's ahead, access treatments that may slow progression, and create an environment that supports dignity and care. While dementia has no known cure at this time, one of the most powerful messages that health experts and neurologists agree on is this: lifestyle matters. What you do on a daily basis, the habits you build, the way you care for your body and mind, can influence your risk of developing cognitive decline, even decades before symptoms appear. Dementia isn't something that just appears overnight. It's a slow and complex process, often rooted in years of subtle changes in the brain. That's why early action is so critical. By making proactive decisions now, people can build what researchers call cognitive reserve, which acts like a protective shield for your brain. This reserve can help delay the onset of symptoms or slow their progression, even if the physical changes in the brain have already begun. It's a kind of insurance policy for mental sharpness, and the best part is, anyone can start building it at any age. One of the most effective ways to boost brain resilience is to stay mentally active. The brain is not a static organ. It adapts, grows, and forms new connections through stimulation and learning. People who engage in lifelong learning, whether through reading, learning new languages, taking up musical instruments, or solving complex puzzles, tend to show better cognitive outcomes as they age. These activities aren't just hobbies, they're workouts for your brain. They strengthen neural pathways and even help form new ones, which can compensate for areas that may be affected by early dementia changes. Social activities like playing strategy games, debating, or storytelling also have a powerful effect on cognition, especially because they activate memory, attention, and emotional processing all at once. It's not about being perfect or academic. It's about staying curious and giving your brain new challenges. Physical activity is another cornerstone of brain health that can't be overlooked. Movement stimulates blood flow, which carries oxygen and essential nutrients to the brain. Aerobic exercises like walking, swimming, or cycling have been shown to boost memory and increase the size of the hippocampus, the part of the brain most responsible for learning and recalling information. Resistance training, such as lifting weights or using resistance bands, not only strengthens muscles but also improves neuroplasticity, the brain's ability to form new connections and adapt. Even modest amounts of regular activity, 30 minutes a day, 5 days a week, can make a significant difference in preserving cognitive function. Physical exercise also helps reduce inflammation, lower stress, and improve sleep, all of which are critical to long-term mental clarity. The science is clear. What's good for your heart is also good for your brain. Eating for brain health has become a focus of many major research studies in recent years. Diets that emphasize whole foods, lean proteins, healthy fats, and antioxidants tend to show strong protective effects against dementia. The Mediterranean diet and its cousin, the MIND diet, short for Mediterranean-Intervention for Neurodegenerative Delay, are two of the most well-studied eating patterns when it comes to preventing cognitive decline. These diets prioritize leafy greens, berries, nuts, olive oil, fatty fish, and whole grains, all foods that reduce inflammation and support healthy brain function. There's also growing interest in the ketogenic diet for its potential to supply the brain with ketones, a cleaner fuel source than glucose. While more research is needed in that area, what remains consistent is this: refined sugar, processed foods, and trans fats are the enemies of a healthy mind. Making simple dietary changes today could protect your memory for years to come. Managing chronic health conditions is also a major part of dementia prevention. Diabetes, high blood pressure, obesity, and sleep apnea are all associated with increased risk of cognitive decline. When these conditions go untreated, they can damage the delicate blood vessels in the brain or cause inflammation that accelerates neuron loss. People with uncontrolled diabetes often experience blood sugar spikes and crashes that negatively affect brain function. Hypertension, or high blood pressure, can reduce the amount of blood reaching the brain, starving it of the oxygen and nutrients it needs to thrive. Obesity contributes to inflammation, while sleep apnea deprives the brain of oxygen at night, leading to memory problems and fatigue. The takeaway here is not to panic, but to take control. With regular checkups, medications, and lifestyle adjustments, most chronic conditions can be managed effectively. And by doing so, you are directly supporting your brain's long-term health. Sleep, often overlooked, plays a critical role in brain maintenance. During deep sleep, your brain activates a unique system called the glymphatic system. This is like the brain's nighttime cleaning crew. It clears out toxins, waste products, and damaged proteins like beta-amyloid and tau, two of the key culprits involved in Alzheimer's disease. Without adequate deep sleep, these toxins begin to accumulate, contributing to cognitive decline. That's why people with insomnia or fragmented sleep often experience memory issues, even at younger ages. Sleep isn't just rest, it's regeneration. Creating a healthy sleep routine, including going to bed at the same time each night, limiting screen use in the evening, and reducing caffeine and alcohol, can dramatically improve sleep quality. And if sleep problems persist, it's important to talk with a doctor. Treating conditions like sleep apnea can protect both your rest and your memory. Habits like smoking and excessive alcohol consumption accelerate brain aging and increase the risk of dementia. Smoking narrows blood vessels, limits oxygen flow to the brain, and contributes to the buildup of harmful plaques. Alcohol, especially when consumed heavily or over long periods, can damage neurons and lead to memory loss. While an occasional glass of wine may not be harmful, consistent overconsumption can have lasting effects. The good news is that it's never too late to stop. Studies show that quitting smoking or reducing alcohol intake at any age improves brain oxygenation and can even reverse some of the damage over time. These lifestyle choices are well within your control and offer one of the clearest pathways to protecting your cognitive abilities long into the future. Although there is no cure for dementia today, the future of treatment is more hopeful than ever. In recent years, pharmaceutical research has introduced a new class of medications known as monoclonal antibodies, which are designed to target and clear beta-amyloid plaques in the brain. These plaques are one of the biological hallmarks of Alzheimer's disease. Drugs like lecanemab and donanemab have shown encouraging results in clinical trials, slowing the progression of cognitive decline in people with early-stage Alzheimer's. While these treatments are not yet a definitive cure, they represent a major leap forward in managing the disease. They offer patients and families more time, more clarity, and a chance to plan for the future with greater stability. Research into gene therapy, brain stimulation techniques, and personalized medicine continues to evolve. Scientists are now exploring combination therapies that approach dementia from multiple angles: inflammation, metabolism, genetics, and neural repair. Treatments like transcranial magnetic stimulation, virtual cognitive training programs, and precision nutrition are being tested for their ability to enhance memory and support brain function. One promising area is the use of wearable devices and apps to track early behavioral and cognitive changes in real time, enabling earlier diagnosis and intervention. Technology, once thought to be a luxury, may soon become a lifeline in the fight against cognitive decline. The key takeaway from this research is simple but powerful. Early action matters. The earlier signs are recognized, the more time there is to implement strategies that make a real difference. Whether it's starting a brain-healthy routine, modifying risk factors, or exploring cutting-edge treatments, the opportunity to act is now. Families that are proactive, that seek support, stay informed, and work with medical professionals are far better positioned to navigate the journey ahead. Dementia is a difficult diagnosis, but it is not the end of the road. With the right tools, knowledge, and mindset, individuals can maintain quality of life, independence, and emotional connection even as challenges arise. As we close, remember this: dementia does not define a person. What defines us is how we respond, with courage, compassion, and a commitment to living fully at every stage of life. The brain, even when challenged, is resilient. It adapts, it learns, and it grows when nurtured. Whether you are watching this for yourself or someone you care about, the most important thing you can do is act. Educate yourself. Support your loved ones. Talk to your doctor. And never underestimate the power of small, consistent changes to protect the most important asset you have, your mind. Thank you for watching, for caring, and for choosing to be informed. If this video helped you, please consider liking, subscribing, and sharing it with others who may benefit. Together we can raise awareness, reduce stigma, and create a future where every brain is honored, protected, and understood.